An environment where we've got rising rates of COVID infection, following the guidance will actually help reduce the spread of infection. So why is reducing the spread of infection important? Well, the reality is that as the infection becomes more prevalent within the community, the risk of spreading it to other people rises. It's not rocket science. It's a very obvious progression of risk. And what we need to be really careful of is that we've got certain people in the community who are really at risk, and those are particularly the elderly, but people who live in institutions, particularly care homes. We know from the first surge of the pandemic that the number of people infected in care homes was very high. We also know the outcomes for many of those patients was very poor. There were a significant number of deaths in care homes close to where my practice is. And that really, we want to avoid this time. We know better now about what the risks are and about how to mitigate. But the only way we can do that effectively is if people follow the rules so that the overall levels of infection start to fall. If they continue to rise, then trying to manage that risk and the threat to care homes becomes increasingly difficult. I would urge people to make sure they understand what the guidance is. It may change, but the information is available online, so people need to look at it, because unless you know what the guidance is, you won't be able to follow it. Following the guidance is important because it's the only way we're going to get infections under control in our community and protect our loved ones and people most at risk.